right, good morning everyone. Okay, so in some very good news, we have no cases of community transmission in Queensland overnight, which is wonderful news. There was one case that was detected in hotel quarantine, and it is the Delta variant. So what we do know is this Delta variant is of grave concern now. It's obviously becoming the dominant virus across the world, and of course it spreads rapidly. So we have 35 active cases. We had 10,087 tests yesterday, so well done. That's absolutely fantastic news. And we've had over 15,000 vaccines in the past 24 hours. In fact, it was 15,356. So that is another record. So well done, Queenslanders, coming out and getting vaccinated. That's absolutely fantastic. Now, the other thing we've detected overnight as well is that we've had some spread of the Delta variant in a hotel. It's the Novotel Hotel. So we are making sure that we look at that floor closely. And once again, we just think it's probably a case of people opening the doors. Dr. Young will talk a little bit more about that. But once again, I stress we need to have regional quarantine. This Delta variant is spreading quickly in our hotels. So we are inspecting that, and we'll be doing an investigation in relation to that matter. Now I want to talk about the issues that are happening in New South Wales, and in particular in Sydney. So the spread of the virus is of particular concern, of growing concern in Sydney, and they have 21 cases now linked to the Bondi Junction. As we know, this Delta variant is much more infectious than other variants, and we have serious concerns. This Friday, and the Deputy Premier will talk more about this, we'll be easing even more restrictions across Queensland, and we cannot afford to have this Delta variant out in our community. So, to keep Queenslanders safe, we will be following exactly what Victoria has announced last night. So we're already closed to the Waverly Council area, but from 1 a.m. tomorrow, in line with the restrictions announced by Victoria, Queensland will close to the following local government areas. They are the City of Sydney, Woolhara, Bayside, Canada Bay, Inner West and Randwick. Now, of course, we haven't heard the update from New South Wales today, so people should be prepared that if there is further spread in New South Wales, this advice may have to be updated during the course of the day or into the evening. Now, we want everyone to be safe, and we wish New South Wales the very best in getting on top of this particular variant. But as we know, we're going well here in Queensland, and we want to continue to keep Queenslanders safe. So a full list will be on the local government, of those local government areas will be on the Queensland Health website. Also too, there'll be increased police patrols. We spoke with the Police Commissioner and the Deputy Police Commissioner along our borders, and there will be a lot more random intercepts as well. So please, if you're from those areas, please do the right thing and stay at home, and we'd love to welcome you back to Queensland at a further date.
Premier, is there any update on the Sydney couple who would come and see their father at the reunion?
Yes, there is actually, and I'm pleased to update in relation to this. So Dr. Young and I have had a lengthy discussion this morning. And what we would like to see from the New South Wales Government, and this is a matter for the New South Wales Government, if they want to break the 14-day mandatory quarantine for this couple, and if they can provide Dr. Young with how they will safely be transferred from Sydney to the Gold Coast, we of course will do everything we can to facilitate the reunion with his father at the earliest convenience.
Those arrangements have already been put forward to Queensland Health. They have arranged for a private jet.
No, well, they have to put that forward today from the New South Wales Government, and Dr. Young will look at that this morning at her earliest convenience. Okay, I'll hand over to Dr. Young. Thank you.
So yes, we have one new case in hotel quarantine who recently returned from Zambia, and we already have the genome sequence on that case, and it's the Delta variant. And that's the major variant we're now seeing in people who are returning from all parts of the world. So we're not seeing that Delta variant only coming from India now. It's widespread, and that's to be expected. When you get a variant that's more transmissible, it then becomes the dominant variant. And we've now seen, of course, this rapid spread in Sydney of the Delta variant, and it's now at 21 cases, so we've had to make that decision here. So I've advised the Premier, and she has followed through, that we will be requiring anyone who's been in those 7 LGAs in Sydney from 1 a.m. tomorrow, I'm not backdating it, but anyone who arrives 1 a.m. after 1 a.m. tomorrow who've been in those areas, coming from those areas, will need to go into hotel quarantine for 14 days. And we'll keep a close eye on whether there's further spread to more LGAs in Sydney. So it is very important that people in Queensland reconsider their need to travel anywhere in Greater Sydney or Wollongong. We've seen some cases spreading further south. So that's important going forward. And thank you to everyone who's come forward to get tested. I know we're coming into our traditional winter flu season, so there will be more people with flu-like symptoms out there. It's really important that you don't just assume that it is whatever your child's brought home from childcare or that it's anything else, that you just immediately come forward and get tested and isolate till you get a negative result. Because although we're hopeful that we have our latest cluster in hand, we know how quickly these things can get out of hand. So no new community cases overnight, and we have all of those people who were at that restaurant in quarantine. So we're managing all of those.
So people from those 7 LGAs will be allowed in the Queensland?
No. No. So anyone from Queensland who's been to one of those 7 LGAs and comes back after 1 a.m. will need to go into hotel quarantine. We've always allowed Queenslanders to return home, of course, but anyone in Sydney who's been in one of those 7 LGAs will need to seek an exemption to be able to come in. And there are some people who can seek that exemption. If that exemption is agreed to for whatever reason, then they'll have to come into hotel quarantine for 14 days.
What's changed in the last 24 hours?
The 21 cases that we've seen, and just the large numbers of exposure venues. There's well over 120 exposure venues, and unfortunately with the Delta variant, we're seeing very fleeting contact leading to transmission. If you remember at the start of this pandemic, I spoke about 15 minutes of close contact being a concern. It now looks like it's 5 or 10 seconds that's a concern. So it's just the risk is so much higher now than it was only a year ago.
But when you spoke of the variant in hotels, particularly the Novotel, is that where the latest case was?
The latest case today, no, I don't believe so. So we've got, I need to clarify, so a few days ago we did have some cases that were reported as hotel assessed and found in hotel quarantine, but now that we've got the genome sequencing back, we know that there's been transmission from one room to another room. So this is on floor 5 of the Brisbane Airport Novotel Hotel, and we had 2 people in one room and 1 person in the room adjacent, and that person in the room adjacent tested positive first, and then 2 days later the couple, or the 2 people in the adjacent room, tested positive. And at the time we thought it was just overseas acquired, but now that I've got the genome sequencing back, it's clear that the first person has given it to the other 2 people. Well, they're older cases. We've previously announced them. So the first, the couple came in on the 8th of June into hotel quarantine, and then the single person came in on the 10th of June, but they immediately became positive, and then the couple later became positive.
So the last time this happened with the Grand Chancellor, I think everyone was moved out. What's happening?
Yeah, so we're contacting all of the 30 people on that floor 5 and anyone who left quarantine during the period that I'm concerned about. So they're all being contacted, and the people on floor 5, their stay has been extended until we've been able to confirm that there's been no additional transmission. I mean, it's reassuring that it's one room to the room next door, and we've seen, unfortunately, that happen across the country in our hotels. We now, of course, have all of our staff fully vaccinated, and all of our staff working in these hotels get tested every single day. We'll retest all of the staff again, whether or not they're at work or on leave, so we'll go back to all our staff and see if there's any positive cases there. But so far, with all of that daily testing, there hasn't been any.
And the 30 who have left, are they being contacted and told to get tested?
Yes, yeah. Well, so we'll follow through all of the people on that floor. I don't know how many there've been. We're still getting that data. We'll follow through all of those and get them tested again.
Dr. Young, why aren't you backdating the restrictions? Is there any concern for people who have been in those local government areas who might not have been in Queensland?
If they've been in exposure venues. So we've had in place now since the 11th of June, anyone who's been in an exposure venue that's been declared by New South Wales, and they're well over 120 now, they are not able to come into Queensland unless they get an exemption, and then they go into hotel quarantine for 14 days. That hasn't changed. So the exposure venues are still there. This is extending it to people who haven't been in exposure venues but have been in that local government area, because we saw yesterday, of course, that 9-year-old child who goes to a school in Waverly that's 2 blocks from the Bondi Junction Westfield, and somehow has managed to get infected, and New South Wales isn't aware of how that's happened.
New South Wales gives updated figures around 11.
They do.
What would it take to lock down or make the whole of Greater Sydney?
Well, we've got a really good system in place now that police can manage very well. So if we see more cases in more LGAs, we'll extend the numbers of LGAs. No. Yes, of course.
Yeah, no, because we've spoken to police and they'll be increasing the number of road intercepts that they'll be doing. So, look, this is incredibly important that people in New South Wales do the right thing and people in Queensland do the right thing. And I reiterate Dr. Young's concerns as well, that Queenslanders should reconsider their travel going to Sydney during this time.
If the Delta variant is more concerning than the original strain of the virus, why are our border restrictions less strict now than they were last year?
Well, I think, there's always the option too for the Commonwealth to declare a hotspot. So I think a lot of the states and territories are also looking to see what the Commonwealth will do in relation to this matter. I know AHPPC is meeting later on today as well. So that's, of course, an option for the federal government. I might just let the Deputy Premier say a few words and then we're happy to take some more questions. All right?
Thank you, Premier. I just want to underline how important it is that we are very cautious in monitoring this Delta strain outbreak in Sydney. We very much hope on Friday here in Queensland to go to what are very low levels of restrictions, and we know that this strain can be spread by just fleeting contact, and so the risk that if we had a case here that we did not know about when we were at those very low levels of restrictions, we could see spread very quickly, and that's why we are monitoring it very closely, putting these hotspot restrictions in place today and potentially more in coming days. We know that that might mean some Queenslanders who had hoped to holiday in Sydney, and similarly some Sydney folk coming up to Queensland might have their school holidays affected, and we don't take those decisions lightly, but it is more important that we can go to those lower levels of restrictions on Friday in time for the school holidays. Of course, we have State of Origin on Sunday as well, and we wouldn't want to put that at risk, although the good news is that all 4 teams, the women's and men's Blues and Maroons teams, are safely out of these locations. We've been saying for some time now, months and months, that hotel quarantine is not proving as effective as it was with earlier strains. We've seen this now with the outbreak in Sydney and also with room-to-room transmission, both across floors in one case and on a floor in another case here in our Queensland hotel quarantine facilities. And that just underlines what we've been saying for a very long time now. There has been a very long time in which we could have built and have operating regional quarantine facilities, but the Morrison government has refused to cooperate with us on them. And they've said this morning that they've assessed defence sites in Queensland and determined that none are suitable for a regional quarantine facility. And I'd just say this, the criteria for a regional quarantine facility that the Prime Minister dropped on us, I think a week or two ago, says that they have to be on Commonwealth land. Now, if they've assessed defence facilities in Queensland and determined none are suitable, well, that doesn't leave any other suitable Commonwealth land. They've effectively ruled out a regional quarantine facility here in Queensland with their repeated additions of new requirements, new federal government criteria. And we would just urge them to reconsider our proposal for Wellcamp, properly consider our proposal for Wellcamp, because we think it is the best available option. It can be up and running sooner, cheaper, and will be larger, will have greater capacity than the Victorian proposal.
Yeah.
Last
Yeah.
year, our water decisions were off with what the Commonwealth advice was at times. Now you're saying you're looking to the Commonwealth.
No, what we've done is we've acted on the advice of Dr. Young, but what has been happening recently is the Commonwealth will also come and declare hotspots as well. So that's an option open to them as well. But in the meantime, we're following what Victoria has done and we're declaring those council areas as
Why
hotspots.
is all of Greater Sydney not a hotspot?
Sorry?
Why is all of Greater Sydney not a hotspot? Is it concerned about the contact?
Because we're focusing on those council areas at the moment, but we're saying that this advice could change, and that's going to be dependent upon what we're going to see out of New South Wales over the next couple of days. So it could expand. I think New South Wales is treating this seriously. We're treating it seriously.
Just on the vaccines, Premier, given
Yes.
what we're seeing down south, do you think New South Wales should get the lion's share of the Pfizer vaccine, given we're back to closing off all these LGAs again?
Well, I think this could happen anywhere. So it's important that the Commonwealth gets as much supply as they possibly can. We were briefed about that at National Cabinet. So we know the bulk of the supply is coming in the last quarter of the year. And up until everyone is vaccinated, communities are going to be continually put at risk. And don't forget as well, what we have seen is that this virus can still be transmitted by people who are vaccinated.
Premier, just to clarify that,
Yes.
back to Mark Killian,
Yes.
they just sent me a double-page letter with very detailed plans about how they were going to get to Queensland, COVID safety protocols. They sent this to Queensland Health a week ago. What is it more that you need them to do?
Yes, we want the New South Wales government to say that they're happy to end the 14-day mandatory quarantine, which is a national standard. And if New South Wales is happy to end that 14-day mandatory quarantine standard, write that immediately to Dr. Young and we will facilitate it. No one wants to see people not see their relatives. I lost my grandmother a year ago. This week's very sad for me. So it's very sad for other people in the exact same situation.
My understanding is that they've already got that exemption. You just want to see it in writing.
It needs to be from the New South Wales Premier to Dr. Young, to myself, and I'll pass it on to Dr. Young, or the New South Wales Chief Health Officer to Dr. Young.
And assuming that's granted, how would his visit to his dad be facilitated?
Queensland Health will facilitate that, and they'll do it. No, they will do it as quickly and as comfortably as possible. But no, excuse me, Jess, if you can just let me finish. These are national standards that have been agreed at National Cabinet, and it's great to see that now that the Prime Minister Scott Morrison wants to go away from those national standards. And if New South Wales wants to not have that 14-day mandatory quarantine, well, we need to also address all that at National Cabinet and work out what the new standard is now right across the nation. So, yeah.
Last week it's gone from a hard no to a maybe. What's changed?
Because it's been the national standard, and we've got a letter here from Scott Morrison now saying that this is now a new standard. So if he's happy to have the new standard, I'm more than happy to facilitate that.
Would they have to go into quarantine once they arrive in Queensland before they store?
Well, we will be facilitating all of that. They will have to, of course, have quarantine here in Queensland, but we'll facilitate them from that quarantine to go to the hospital and see their father as quickly as possible.
Do you accept some of the responsibility for UNESCO's staff decision?
In relation to the Great Barrier Reef, I mean, it is an international icon and everybody loves the Great Barrier Reef. And I think what we need to see is both levels of government working cooperatively. And, you know, we have put our money on the table for the Barrier Reef. We've stopped the dredging of our ports. You know, we've done a whole lot. We put a whole lot of money into it, but now is the time for, I think, you know, greater cooperation with the federal government when it comes to the Great Barrier Reef. And I think what we've seen now, the greatest risk to the Great Barrier Reef is the National Party in Canberra. Sorry?
Recruiting debt collectors to chase up
Yes.
old invoices for quarantine. Do you
Yes.
support that?
Well, taxpayers' money, and you know, taxpayers have been paying for this, and we want to make sure that people are paying for their quarantine. This is a requirement that that's been put in federally as well. So we want to make sure that, and if we need to recoup that money, it's taxpayers' money.
How can you push this responsibility onto the federal government when your government approved the Carmichael coal mine?
Lydia, it's not about that. It is about the Great Barrier Reef and all of the regulations we put in place, the reef regulations, improving water quality. These have been actions taken by our government.
You don't think that thermal coal mines pose a risk to the Great Barrier Reef?
The greatest risk at the moment is the National Party in Canberra.
How?
Well, they're the ones that are proposing a coal mine right on the Great Barrier Reef.
You approved a thermal coal mine.
And there's going to be, coal is going to be needed across the globe for many years to come, including gas, including renewables, and that's why we have a 50% renewable energy target by 2030. And that's why my government in the last budget just invested $2 billion in renewable energy.
But do you accept that that would have an impact on the Great Barrier Reef?
Building a brand new coal-fired power station adjacent to the Barrier Reef by the National Party, yes.
What about the thermal coal mine in terms of quarantine?
These are all in the plans and already underway.
Okay, last question.
Can I
It's
just
just-
get clarification on the broader checking in that we're going to have to do from Friday?
Yes.
People are asking us, they're a bit confused. Do they just check in at, you know, the entrance to a shopping centre or
Correct.
individually at
You
Coles
can-
and Woolies inside?
Yeah, it's just, you got to check in when you go into a shopping centre, but if you're going into Coles or Woolies, we do need you to check in there, okay? Because of this fleeting contact, this Delta variant is of grave concern.
And for older people who might not have, you know, a phone that can do that, will that all be?
Most people do have phones, and you know what you do see is if families are out with their grandparents, they can check in for them. And I'm not saying my parents are old, but they're in their 70s and they're very happy to use that check-in app. So if they can do it, I'm quite sure a lot of other people can as well. Okay?
Dr. Young, do you have any facilitated the camera arrangements that you said you might be willing to?
Sorry?
If the New South Wales Premier or Chief Health Officer writes to you and Dr. Young granting that family unit?
Yeah, we said we're going to sort that out, yeah.
Yeah, would you be open to extending that to other families?
Well, if it's the new standard by the federal government, it has to be approved at National Cabinet.
So how soon would that family be able to have a visit?
As soon as they can get transport approved by the New South Wales government. Okay? Thank you. Thanks, everyone. Thanks for coming.